Be aware of who you sit next to. I sat next to Alan last summer at the annual Pediatric Leadership Conference in Chicago and introduced myself. Networking 101. Alan turns out to be one of a very small group of doctors who are not pediatricians, not internists or doctors for adults. He is both. He trained in both pediatrics and internal medicine. Our discussions led from one thing to another, and here he is with his team to talk about community-based care. Dr. Alan Friedland is the MedPeds Program Director and Section Chief at Christiana Care Health System in Delaware. From 2009 to 2013, he was the founding medical director of what is now called the Center for Special Health Care Needs. He is a primary care MedPeds physician and is current board member of EPIC, which stands for Endless Possibilities in the Community, a not-for-profit organization whose mission is to improve health through fitness for people with disabilities. His team members include Terri Hancharick, who is the co-founder and president of the board of EPIC. She is the parent of a woman, 37 years old, with complex cerebral palsy. The birth of her daughter altered Terri's worldview, and since that time she has devoted her life to service delivery and advocacy for children, youth, and adults with disabilities. Terri has served on many councils, communities, and task forces in the state of Delaware, most recently on the Care and Communities Actions Committee of Governor Matt Meyer's transition team. Terri founded EPIC along with Jadach to improve the health and community experiences for her daughter Bridget and other people with disabilities in Delaware. Jadach co-founded Endless Possibilities in the Community, EPIC, in collaboration with a parent advocate and other community stakeholders. Jack dedicated 37 years to service supporting students with moderate to severe physical and intellectual disabilities, ranging from ages 3 to 21 in various roles, including vocational horticulture teacher, assistant principal, and principal. EPIC is an inclusive, community-based wellness program that provides meaningful, self-determined fitness and social skills activities, empowering each to lead more productive, healthy, and active lives. Please welcome Alan, Terri, and Jack.
Well, thank you. And John, it was great sitting next to you, and it was great being able to connect and have this opportunity to present to your entire audience. So I'm Alan Friedland, and when I look at this picture in this first slide, I see just some of the incredible young adults that have benefited from this group's work, EPIC's work, or Endless Possibilities in the Community. What I see when I look at this set of pictures are people engaged in activities, physical activities. I see different types of equipment used, and I see others around them. This is EPIC, and I'm so grateful to have the co-founders of EPIC here for this presentation and for their vision. The title of this slide matters, and each word matters, just like the pictures in the previous slide. Collaboration, meaning EPIC, the community, and the health system. Health meaning promoting health to prevent chronic illness or reversing some chronic illness. Adults with disabilities is our target audience, and community fitness facilities are all located in the state of Delaware. Although we have no conflicts of interest and we're all on the board, we have so many common interests, and the three of us presenters are all on the board and do not receive a salary from EPIC. We have an alignment of our interests, even though we all come from many different backgrounds and interests, and hopefully you will be enamored by their stories, their successes, their hard work, and even some of their challenges in getting to this point today. We all know that physical activity is the driver to prevent so many things, and our young adults with disabilities struggle from too little physical activity and too much in the way of mental health challenges, obesity, and diabetes. This, although is Delaware data, I am sure, and you are familiar with this similar data within your own communities. There are so many barriers for people to succeed and become more physically active. It's the lack of training and knowledge of fitness staff, fear and liability or concerns from the fitness staff, participants, and families, and lack of funding for appropriate, inclusive community wellness programs. I am happy to say that EPIC has found a way to mitigate these barriers for young adults to participate in inclusive physical activities. So now you will hear from the true champions, Terri and Jack.
Thank you, Alan. My daughter Bridget is 37 years old and has complex cerebral palsy. Jack was her principal and I was the PTA president for many years. Bridget is also very fortunate to have Alan as her primary care physician. When Bridget graduated from school at the age of 21, where she had a robust program with therapy and physical activity, she went into a typical day program where services were based on eligibility and not entitlement. She was very bored. She came home with her shirt soaking wet from chewing on it, and she just wasn't happy. She lasted a year or two, and I took her out of the day program. It wasn't that the day program was bad. It's a good program for families who have to go to work every day or who need the break during the day, but it wasn't a good fit for Bridget. She spent a few months after that at home. Bridget had grown up with 5 brothers and people constantly coming in and out of the house. Now her brothers were growing up and leaving the home, and I needed to find other opportunities for socialization and physical fitness for her. Jack had retired from the school where he had worked with kids with disabilities for over 30 years. I called him and asked if he was interested in starting a nonprofit. Jack never says no if he thinks he can make a difference. We did the things we needed to do for a nonprofit, creating a 501c3, putting together a board, and decided what we wanted our mission to be. At the same time, I would watch my husband and 5 sons go off to the Y for the evening while Bridget and I stayed behind. I wrote an email to the director of the local Y. I said that the Y was supposed to be a community, but yet there was nothing for my daughter to do there. There was very little accessible equipment or people trained to work with her. The culture of the Y was not welcoming. Members would stare at Bridget and whisper. They were not used to seeing people like her in the community, especially in a fitness facility. The director asked if I would come meet with the COO of the YMCA of Delaware. I brought Bridget with me and expected to have a fight for things like I usually do. Instead, I was met with a welcoming smile from 2 people who wanted to make a difference. The COO had done his homework and said he had heard I was co-founder of a nonprofit. He asked what I needed. I said my daughter spends much of her day in her wheelchair, and if she spends her life like this, she will die early, and I'm not going to watch that. He then asked if we wanted to bring EPIC to the Y. That was the beginning of a beautiful partnership. The COO retired from the Y 2 years ago and is now a valued board member for EPIC. When people ask him why he did what he did, he says because it was the right thing to do. EPIC is a vendor for the Delaware Division of Developmental Disabilities Services, DDDS. DDDS serves people with intellectual disabilities. In 2020, we received a call from Special Olympics saying that there were 2 people with physical disabilities who worked out in a gym, and the gym had closed because of COVID. Both used a wheelchair. One of them called us to say that because she was no longer able to work out, she was losing her upper body strength. She no longer had the strength to lift herself from the wheelchair and help with transfers. She was crying and very upset because her aides were not able to lift her into bed, and she was afraid she was going to end up in a nursing home. We brought both people to the Y without any funding because they did not have an intellectual disability. Therefore, they were not funded under DDDS. We did end up getting some pilot program funding from the Division of Services for Aging and Adults with Physical Disabilities. We call that program the EPIC Abilities Program. We formed a partnership with our largest hospital system in Delaware, Christiana Care. People with physical disabilities who wanted to take part in EPIC Abilities first had an evaluation from a Christiana Care physical therapist. From there, the PT wrote up guidelines for our physical therapy assistants who worked as fitness coaches. It was no longer physical therapy, it was fitness goals, but with the safety and knowledge built in from the physical therapy assistants. Next slide, please. This is our memo of understanding with the why. We pay a monthly rental fee for each site. For the first few years, we were not charged anything for rent. We were given full access, and we are still given full access to the facility, indoor and outdoor pools, participating in fitness classes with other Y members, indoor and outdoor basketball courts, which also give our members a chance to play against other Y members. Here are just a few comments from Epic Abilities members. The first one was, I'm able to push up on all fours and push up in the event that I fall. My stamina for walking has greatly improved. I have more ability to reach things on my table in my apartment, and transferring on and off the toilet has gotten better. Second one was, working out is a vital part to continue to live a highly functional life. The people that work with me each day, I believe, genuinely care about my well-being and how I feel. I believe that my body has improved tremendously. Another was, I find it easier to go through my day. I set a goal to complete a 5K. Another, my legs are stronger as well as my arms. My goal is to get my legs strong enough to walk again. And two more, I have more energy and can accomplish more because of that. Putting on my braces is no longer a chore. Stretching helps me through my week. Being social is important to me. It's the main place I come for communication outside the four walls of my home. The last one is, Epic Abilities has enabled me to participate in an adaptive gym environment, and it has enhanced my ability to move around my community. This is safer than just relying on the average gym trainer who would not understand how to work with me correctly. There would also be an immense cost in paying for a gym or trainer because I'm not able to use the equipment on my own. Next slide, please.
Epic is the epitome of a grassroots organization. The program started with one site, and now we've expanded to 5. For the first 5 years of operation, I served as the on-site volunteer program coordinator with Terri as my backup. We were low in funds, so we utilized University of Delaware behavioral health and nutrition and exercise physiology interns as our staff. They did a great job and took us to a place where we received funding and were able to hire full and part-time fitness staff and an executive director. The other thing is that Epic is a program without walls. We don't have a tangible building. The Y, the inclusive community fitness facility, serves as our site location. Next, Alan. Currently, Epic has 152 members, 30 staff in our program funded by DDDS, ages 18 to 50. Each member, as we call them, as Y individuals are members, receive units from which we base their allocation of services. Typically, our members participate 3 days a week, and within that, our program operates 2 sessions, 9 o'clock to 12 o'clock and 12 o'clock to 3 o'clock. Now, during that time, our members don't work out 3 hours. You know, none of us do. So within their time, we intersperse instruction, nutrition, social skills. And, you know, we are within the Y confines. I just want to give you a sense of the individuals who we serve, you know, within the program, and just some of the how folks are classified. Okay. Next, down. Our abilities program is different. These are folks with physical disabilities, and the ages range from, yes, it is 28 to 90. The 90 is not a misprint. And what we do is this. We want to ensure safety. Again, and knowing Bridget, knowing the amount of surgery she has, we want to ensure that every transition, whether it's, you know, from a wheelchair to a stander, whether it's from her wheelchair for working on range of motion, is done safely. So we have hired physical therapy assistants who have the enhanced training to work with our individuals. Initially, they go over, they receive a workup, a physical therapy workup at Christiana Care's website. And at that point, the physical therapist talks with our fitness staff. Now, there is an exchange of information where physical therapy information becomes translated into fitness. We cannot provide physical therapy because we do not have a physical therapist on site. So I know it's semantics, but it's also legalities too. So we're enhancing the support and the safety at the same time having the background of folks that have enhanced skills. Next down. Okay, now we're going to show a brief video just to give you a sense that of EPIC in action. And please know that we work within the hallways of the Ys, and that it's an exchange both ways. I can't tell you how many times we've seen our members walking down the hallways with support, and a lot of attaboys both ways. So as a YMCA member says, great job, we want our member to lift their head up and in some way give a greeting back. We want to increase social skills just so they recognize that it's their community too. And in this way, we think that we're really enhancing the overall understanding, within the community, and we feel very much accepted in all of our sites.
The Americans with Disabilities Act was signed in 1990, and the ADA made it so that people actually belonged. We still have a way to go. A lot of people made a lot of sacrifices for it, getting out of their wheelchairs and dropping their crutches and climbing up the steps of the Capitol so that my daughter and others could enjoy the freedom that everyone else does. The COO and the director of the Bear Y called me in to talk. They said, what are you looking for? And I said, well, Bridget sits in her chair all day, in her wheelchair, and if she doesn't get out and do things, or she doesn't get some movement, she's going to die early. And I don't want to sit and watch that. And they're like, we heard about your program, would you like to bring it here? And it just started this wonderful partnership that 5 years later is still going strong and expanding to other Ys. EPIC stands for Endless Possibilities in the Community. So if you walk through the Ys gym, you can see that people with disabilities are doing their exercise, and there are people within watching distance of them, but they're on their own. The goal is they will then know how to work out and make it part of their day and part of their life.
When we did introduce EPIC, Alan used the word collaboration, and it's ongoing. And flexibility is a huge component of collaboration. Currently working with the Y, we presented a very positive picture. We had some challenges. One of them is that the Y, they would like to limit, our number of members to like 8 per session. They just want to make sure that we're not out of ratio, of having folks with disabilities outside, and also the use of equipment too. So we're negotiating, that part. We also recognize that, again, equipment is necessary, and we've worked with the Y in terms of sharing resources, to purchase equipment. So in terms of the standards, the gait trainers that you saw, those are ours, but we also let the Y members have access to them too. When we talked about the abilities program, we did have some measures where the physical therapist had a pilot program where our members came over to their site every 6 and 12 months, and there was really there was goal progression. We saw a progression in our members not only meeting their goal, at enhanced moving at higher rates, but also goals of progressing at the 12-month and 6-month period. So we're seeing a lot of nice progress that way. The next slide, Alan, was where we used a quality of life measure, the GROC, a global rating of change. And there was a question asked. It was basically, what is your perceived functional progress from the beginning of your pilot program, to now? And it was rated from a 1, almost the same, to 7, a very great deal better. Now, our average score was 4.5, which indicates moderately to a good deal better, achieving functional progress from the start of the pilot project. So you can see the variety of members that we have. And to be honest with you, we don't look at disability, we look at ability. The only thing that we have to address sometimes is that we recognize that working with the confines of the Y, we always use the word, it's their house. And what we mean by that is we need to be able to meld ourselves within the fabric of the Y. And sometimes there are some of our members who maybe exhibit some challenging behaviors where we have to, take a step back and work with individuals, and hopefully they can interact within the inclusive setting. A lot of times these folks have come from segregated settings. This is their first opportunity. So there's a big change. And this has been very positive, where we've just seen, just the growth, but also I'm always amazed at how smart these adults are. Sometimes when you look at the disability, and I'm on a treadmill with them, and I say, how many more minutes do you have left? They do the math. They do the programming. It's just each day, it's just a gift. So just want to say that, we are an open book. We really appreciate the opportunity to share, our successes, our challenges, and at any point forward, we're always a resource for questions, from you. So at that point, we'll entertain questions. And this is our contact information.
Thank you so much for sharing your amazing community collaboration program that meets the physical as well as other expectations and needs of people with a variety of abilities. So I'm going to start off with a global question, which is, how does embedding the EPIC activities change the YMCA and their other members?
Everybody's perceived as the same. Our members receive membership cards. When they go to the front desk, the expectation is they're going to sign in, say hello as they're walking to. We have a little area where we gather as they're going to and in preparation for. So our members go to their lockers and then they meet with their fitness staff. And typically our fitness staff works on a one-to-one basis, maybe 1 to 2, depending on what the activities are. And it's very positive. If I could just say, just yesterday at one of our sites, and again, one of the members presented us with a check just in additional support of our members seeing the work that's being done. So those nice things happen. I can't say that we really have had a negative, but I will say that sometimes we had to get a little bit smarter where we had too many folks using the treadmills at one time. So we had to just kind of disperse. So again, that feedback comes back to us and we answer it. We're honest. We say, yeah, we'll go to other parts of the building because we have access to the whole building. So.
And we have regular meetings with the YMCA staff. And we're also at another athletic club outside of the YMCA. So we have regular meetings with them and they bring up anything that is bothering them. If there's something we've done that they would rather us do it another way, or, if we have to move our program into other rooms and not be in a room for the day because something's going on, it's a wonderful partnership and it's open lines of communication.
And just for example, the Y has a summer program. At that program, everything changes. So we have to move, somewhere else because again, they get large numbers of kids and we just we're smaller numbers. So we just adapt.
400 kids a day.
If I could just add to those comments, I think the participants in the Y that are not in the EPIC program are gaining a lot. And I would imagine that the children that are there become in a more inclusive atmosphere that they may not have been exposed to before, and they will be better adults because of it. One of the things that Jack mentioned is sometimes depending on the distribution of the kinds of people that are there at the Y part of EPIC, sometimes the year is more difficult. So those with perhaps sensory impairments, the summer you would think would be the best, but it's probably the worst because there's too much chaos and other things going on. So we have to adapt and perhaps headphones and other things to sort of make sure that things like behaviors occur, that proper behavior is happening and that other people are safe, etc. We also have to be mindful of some of the medical conditions, particular seizures and other things. So there's a medical component to it as well, too. There's an exercise prescription. There's a lot that goes into it. I can't even tell you how I'm so amazed at what Terri, Jack, and now a hired staff can do. And I know I couldn't do this as a physician, no matter what. And I am just so humbled and inspired by their work and their families and everybody around them.
Thank you so much. So I'm hearing flexibility, feedback, and ongoing communications. Clarissa?
Yes, I am impressed that you have collected data on outcomes. And it sounds like you've collected data on functional outcomes and quality of life outcomes, but I am wondering if maybe the next step might be medical outcomes like constipation or hospitalizations for ambulatory sensitive conditions like urinary tract infections and aspiration and other things. Just having that community connection can help reduce hospitalizations because people notice things more quickly, or rashes or pressure sores or other kinds of things. Um, have you thought about doing any medical outcomes for your program?
That's what we are hoping is our next step, and Alan can probably speak further to that. But as a little side story, my daughter had some aspiration pneumonia, and she ended up in the ICU, and the doctor came in and said both lungs had collapsed. We don't know what else to do. And it was amazing. I said, may I bring her stander in to help, elongate her lungs and have her standing? And he said, yeah, we'll try anything at this point. She was in her stander for an hour, and then again for like another half hour later, her lungs, and I don't think it was anything other than the stander, because they had run out of things to do with her, and her lungs greatly improved.
That's an important story. Glad you told it to us.
I think it's very difficult to scientifically measure when there's so many different conditions and combinations in the numbers that we have, and do it in a rigorous way. We do know that for those that complete and really attend most of the EPIC sessions will have blood pressure and or weight be lowered. We do know that there's a carryover effect in terms of behavior that comes to the house on in-between days that they're not at EPIC. But to put this scientifically in a journal is problematic. And you would definitely, I totally see where we need that. We would definitely need funding and someone who's a health disparities researcher and really knows this literature really well, and how to measure it without a lot of confounders.
And as a mom, I can speak to the constipation issue, the issue and that's a big issue for many people with disabilities. That has been a big help for that. Also, the days that she has EPIC, I can speak to that she'll sleep 12 hours that night because she's had that exercise that she doesn't normally get. I mean, we try hard at home, but it's not the same as being with a group of people and having everything going on around you. And I don't know if Alan wants to talk about his interns that he sends into EPIC and how that's kind of changing the face of, or showing them what it's like, what people are like with disabilities outside of the medical arena.
So we have medical students and residents participate and come to EPIC to actually see how it is, because we only view the medical part. They may be in an ICU or in an inpatient setting or even in an outpatient setting, but they're not seeing them in the community setting. And so every one of my residents needs to experience the community aspects. And so they go and work under Jack and Terri. Often we've had them sit on board meetings to see what we discuss as a leadership team. We have them work in the outpatient arena with those that work with special healthcare needs. And then we also have an inpatient service that has people trained like myself, but I'm an ambulatory physician. Those that are hospitalists will take care of them in an inpatient setting. So there's communication across a 360 of their health, and sometimes when they're not healthy. And so that's our fortunate situation in Delaware. We're very lucky to have these resources, but I think the resources that we didn't have until EPIC was really a community focus in Delaware. It was really not community-based. The fact that they're able to bill appropriately for services outside of, it's not a physical therapy, it's really fitness oriented is really a gem. The challenge, as you probably all know, is ongoing funding. Medicaid, et cetera, it will not pay to keep the lights on and the staff moving. So we really have to be very philanthropic and really working with the community and our other stakeholders to sort of be able to contribute so that EPIC and EPIC abilities can prosper?
So the sustainability is one of the questions that came up from the audience, and so how do you what do you do in terms of funding, and from year to year or maybe longer periods?
So the people that are funded through DDDS with intellectual disabilities, there is a steady stream of funding for them. The issue with that is sometimes it takes a long time through billing, and there's sometimes little mistakes are made in recording things, and we're waiting a long time for that money to come through, but it is sustainable through that. The issues we're having are with the people with physical disabilities who do not have an intellectual disability. We've gotten a grant each year from DSAPID, Division of Services for Aging and Adults with Physical Disabilities. And they've been very generous with us, but it still doesn't pay for the quality. So if we're paying PTAs, we're paying a much higher level than we are paying to fitness instructors, because they do have the experience and the knowledge to work with the group of people. And we know that the people will be safe, and that's paramount. So for paying that staff a good salary, and that's also a little bit with the DDDS program, because we have some people with physical disabilities along with intellectual disabilities who do need that extra help when standing or doing fitness activities. So they're not used to paying for that. They're used to DSPs who they have always paid poorly. Across the United States, they've been paid poorly, and they're now beginning to see that they need to start paying more. But with our staff, because of the fragility of the people we have, especially as people are getting older, osteoporosis, very thin bones, we have to be so careful putting them in and out of equipment. We can't just have a fitness instructor do that. And we also have employed a grant writer who has written we've been very fortunate to get some wonderful grants from the state of Delaware. We haven't written any federal grants yet. And I think that would be our next step also, is to find someone to help us to write federal grants.
A couple of other questions. Perhaps one is partnering with other groups such as public schools, elementary, middle, or high school, because they also provide opportunities for activities.
Yes, we attend transition fairs. We go out into the community. We have our flyers available, for folks to transition. Now, one thing to remember is that our program is not a full day program. It is a program that operates, a couple days, for the individual, not on a full-time basis. A lot of the folks transitioning from school age to post-21 are looking for a full day program. So this kind of meets the needs of certain individuals, but others may fall outside of what their expectations are.
And so people with complex physical conditions, they can, like my daughter, cannot sustain a full day program. 5.5 hours is much too long for her to be there and sit in her wheelchair. And I don't want someone without the training needed to put her into equipment. So this really fit the bill for her. 2 hours is great. She's exhausted. It was perfect for her.
In our perfect world, we would love to have EPIC combined with other community programs. For example, is there something that's volunteering? Is there something along another line where folks have interest, and then putting their own individual schedule together instead of being in one segregated group?
Well, thank you so very much for an amazing presentation of an amazing program. I think people are asking whether there's an EPIC West somewhere in this Bay Area. But
we would love to come tour and start an EPIC West.
We almost got on the plane accidentally, and we would have been on your doorstep this morning at UCSF.
Thank you so much.